October, and I'm here to talk to you about something important. Did you know, according to the CDC, 130 Americans die daily from opioid overdose? That's nearly 48,000 deaths per year. I'm here to talk to you about what is an opioid, what is being done to help regulate the over dispensing of opioids, and also what resources are available to help people addicted to opioids. First, what is an opioid? An opioid is any street drug. Some examples would be heroin and fentanyl. Also, an opioid can be prescribed from your doctor. A lot of times it's pain medication. Some examples would be oxycodone, codeine, morphine, tramadol, and oxycodone. A lot of the times, people that start from pain medications, if they become too expensive for the patient, so then they look to alternatives, which would be any of the street drugs, such as heroin or the fentanyl, which are highly dangerous. So some laws that are taking place to help the epidemic is there are laws in place that help limit patients' prescription to a 10-day supply. So some people that would be excluded from the 10-day supply are people that have chronic pain, such as arthritis or even cancer. According to the pharmacy.texas.gov, prescription monitoring programs, such as also called the PNP, is a website that doctors and pharmacists use to see when and where a patient's last opioid was prescribed. Some resources that are available for patients on opioids or even street drugs. There's a phone number that you can call to help. It's 1-800-622-4527. Also, there is a drug that's over the counter available at the pharmacy. It's called Narcan or naloxone. Most insurances do pay for it at a low copay, or they cover all of it. Also, if you don't have any insurance, it's roughly about $150. So, according to medsafe.org, a lot of the signs for overdose would be blue lips and fingertips. Also, if a patient is non-responsive or not breathing. Also, if they have lost their color or are clammy or pale. That's probably this time that you would want to call 911, or if you have Narcan or naloxone available, to use that. Also, there is a new disposal that a lot of the pharmacists give you when you get your pain medications called Disposer X. So a lot of the times people don't finish their pain medications, so they just leave it in their counter. Well, this is a safety concern. So you would want to dispose of those medications because a lot of the time people want to abuse your medication. So like younger kids, teenagers, family, anybody that can abuse your medication, you want to get rid of it. So with this, all you got to do is open this little packet. You empty all the powder that comes with it. And then you'll want to use just, regular water. Fill it about 2/3 weight. Shake it up. Now most of the medication is dissolved, and you just throw it away. So that can help a lot of people from other people just abusing their medications in their cabinets that they're no longer using. So I hope that you guys took away some important topics from my video. Now that you have a better understanding what an opioid is, how the doctors and pharmacies are working together to limit the use and abuse of opioids, also what resources that you might have Maybe you have a friend in your family that's might be addicted to these medications or even street drugs. Thank you.